20. Well, there is growing concern over the number of younger Minnesotans in hospitals with COVID-19. For the first time in the last year, the CentraCare Health System says 70% of its hospitalizations are patients under 65. Staff suited up WCCO's Liz Collin to safely take us inside St. Cloud Hospital to see why its sickest patients are suddenly decades younger.
It's a big deal. It's nothing to mess around with, that's for sure.
It is not the face you'd expect to see in a hospital bed fighting COVID-19.
As the days went by, it got a little harder to breathe, and before I knew it, I'm in here.
When Eric Akers' symptoms set in a couple of weeks ago, the 26-year-old wasn't overly concerned.
I figured it'd only be maybe a week max, and I'd be over it, but it wasn't in the stars for me.
Instead, oxygen, IV fluids, and steroids treat his inflamed lungs.
The demographic is very different. That and the acuity of illness is much higher than it was this past fall.
So they're sicker now?
Correct, yeah, much sicker.
One floor away, St. Cloud Hospital cares for those in worse shape. Dr. Tim Ely looks back on just a month ago when 2 COVID patients were in the ICU. For weeks, those numbers have been back in double digits.
It's disappointing, a bit demoralizing.
Dr. Ely suspects spring travel and the UK variant are partly to blame. While hospitals don't receive test results directly, it's considered the most common across the country and a more dangerous mutation.
I don't think any of us thought this would be going on this long.
As an RN, Kate Wieland has been there for the more than 400 patients in the ICU since the pandemic's start. There are subtle reminders of the early support. Staff masks stored in paper bags now fill most walls.
I can't go home and talk to some friends or family about this because there's almost a huge disconnect. So that's been really tough. How do I cope?
Wieland's watched some colleagues take different jobs or stay home altogether, as strict protocols and isolation take a toll.
And seeing these younger people come in when I know the vaccine is available for a majority of them is tough.
That is perhaps the biggest fear moving forward, that there won't be enough public buy-in to the vaccines to protect everyone. Doctors believe that will make the biggest difference against any more dialing back.
I don't believe I've seen somebody die yet that has been fully vaccinated or even hospitalized here in the ICU.
As a machinist, Aker was eligible for the vaccine last month, but believed older workers should go before him.
People that I felt really needed it to get it first.
He knows the timing still may not have mattered for his case. He's hoping his message does now.
Wear your mask, get vaccinated when it's your turn.
In St. Cloud, Liz Collin, WCCO 4 News.
And Eric, that patient you just saw is home now. Doctors told Liz the younger people they're seeing have very few risk factors like being overweight or having high blood pressure or diabetes. And even if these patients survive, some could still be compromised for the rest of their lives.